please join me in welcoming Mrs. Tina Hostovich.
I'm from New York. So when the forecaster said it's going to be dense fog, that means I'm not going to see too much. Okay, so I mean, I got to put my high beams on, I'm not sure, I'm going to take my time. So it's dense fog. When I came to California, I said fog. They were like, oh, we don't have fog, we have marine lake. So just think of the worst, marine lake. Okay? You can't see, right? You can't see the house in front of you, you can't see the car in front of you. That's what it means to be dense. Your breast tissue is like that.
Okay, you hear the laughter? Well, that's all right, because over 95% of all women in this country don't know what their breast density is, and that is a crime. Why is it important to know? Well, number one, over 40% of all women in our country have dense breast tissue, or what we call DBT, dense breast tissue. If you are African American, it's over 60%. If you are Asian, it's 65 to 70%.
If you have pain when you go to the bathroom, there's something wrong. Hemorrhoids do not cause pain, unless there's a clot, and then you can clearly see that.
Hi, I'm Lena L. Kennedy, the founder of the Southern California Women's Health Conference. Thank you so much for joining us, and this has been a delightful day. We've had some wonderful highlights. At our morning session, we had Congresswoman Judy Chu. We had Assemblymember Mike Gatto, and they talked about healthcare reform. And at our luncheon, we had the phenomenal Dr. Watts. In addition to our keynote speakers, we had 26 workshops from doctors across Southern California participating, of giving of their time freely. We focused on heart disease, female-related cancer, hypertension, diabetes, and then we also had a focus on the health and beauty of the woman. So it was a delightful day with over 1,500 people here enjoying information, becoming more informed, and doing health their way.
It's important for me to be a part of today's health conference because I'd like to get the message out that it's very important to preserve your vision. Today, many diseases affect the back of the eyes, like diabetic retinopathy, and that could be the leading cause of blindness in those patients between the ages of 35 to 55 years of age.
I was invited to give a talk for the Women's Conference on sexuality as you age. Apparently, this is a very interesting subject for the constituents, and I was very happy to do it, as I've done talks on this subject in the past. Intimacy and closeness to your sexual partner is always an essential part of sex, but as you get older, it becomes a more significant aspect of your life, and it can increase your intimacy with your significant other, but in and of itself, it is essential.
I'm going to tell the ladies today about why it's so important to be on top of your mental health. We know that there's a direct correlation between mental health and physical health, and if you aren't there and you're not on point, then everything else is just going to start falling around your ears, and it's going to be more challenging.
My message mainly is to discuss heart health, which is extremely important because we're seeing a very steep rise in the amount of heart disease, especially in the female population. And this is the Women's Conference, so that's what I'm here to discuss.
I really believe that women have a more difficult time getting access to health care and identifying what they need to do. And there isn't always a support system surrounding that. My mother died of breast cancer, and I saw how difficult the process was to navigate for her. I've had some health challenges in my own life, and I've seen that if you are not an advocate, if you don't have resources, if you don't have someone to turn to, a lot of things can go differently. And I want all women to have access to choices and options and resources.
Hi, I'm Ellen Liggins, President of the Pasadena Alumni Chapter of Delta Sigma Theta Sorority. This conference is very important to us because physical and mental health is a part of our national program thrust, and this is our way of fulfilling that part of our national mission as well as our own local mission.
The conference was wonderful. The workshops were informative. The vendors had a lot to offer. I got a flu shot. I had my blood level checked for diabetes.
The conference was wonderful, as usual. I always get so much from it. I get so much education and learning about myself.
I'm Lena L. Kennedy, founder of the Southern California Women's Health Conference, and we will see you next year.